Nurses rallied in front of City Hall last week seeking a fair and equal contract. They state that the mayor is now paying them significantly less than in the past. In Newton, as well as 90% of other school districts in Massachusetts, public health nurses have always received pay parity with the teachers. After all, Newton public health nurses are required to have the same education, certification, and licensure as teachers, along with their professional license in nursing. But when their 2014 contract expired in June of 2019, Sue Riley, the Massachusetts Nurses Association president of the Newton Public Schools chapter, said that the nurses were, quote, devalued by the city, leaving them without a contract.
I wasn't as concerned about the fact that it was expiring, but what I was really concerned about is a lack of respect and the devaluing of the nurses that's been happening as of late.
In October, Mayor Fuller finally agreed to negotiate, but while the teachers were able to successfully settle a new contract that provides them with 10+% pay increases over 4 years, the mayor's team made a proposal that the nurses' pay scale would decrease to very close to 0%, setting the nurses back about 20 years and keeping them from maintaining parity with the teachers.
The teachers settled their contract, but we didn't settle ours. Thank you.
When the nurses met once again with the mayor's team on the last day of school this year, Ms. Riley said the nurses were told they should come back to negotiate next March, leaving the school nurses yet again without a settled contract. Though the issue had begun long before the advent of the coronavirus and defund the police movements, things have now gotten just a little bit more complicated. When the mayor responded to the many concerns of Newton residents about the city's 2020 budget, she worked to reallocate the funds. But the one thing she didn't consider at the time was the nurses. In September, a nurse saved a life in the Newton Education Center, but she, like many other nurses, have never received any recognition.
Well, we hope that the mayor will see that the amount of money that is needed to bring a small number of nurses up to the same level as the teachers in their contract is on the scale of things a small amount for her to do, particularly considering the fact that this is a time of health crisis, and the school nurses are the people in the buildings with the greatest amount of health expertise.
With all Newton Public Schools possibly reopening for in-person classes in the fall and only 28 nurses available, public health nurses will become more essential than ever before. In a flyer which was handed out during the demonstration, it explained that, quote, despite going a year without a contract when the pandemic hit, school nurses stepped up, providing contract tracing for the community, reaching out to educate students and parents, and working with parents in need to ensure they have access to food and other resources.
I just don't understand, because obviously these are essential workers. They should be in the schools now preparing for COVID, and they're not because of this contract, not having a contract. They are going to be so needed.
If Ms. Riley met with the mayor in person,
I would just like to have a dialogue with her so that she could look at me and I could look at her, and she could truly explain to me why she doesn't feel like the nurses are respectfully asking for something that is not out of reach. We're not in it for the income. I mean, it's a cliche, but we're not in it for the income. We're in it for the outcome. And I just want to hear from the mayor how she can justify, looking at all of us and the good work that we do in the city, that our raise increase is not justified in her budget. And I just don't understand, none of us understand where she's coming from.
The children are the most valuable resource in Newton.
That's right.
And we, the Newton Angels, are going to keep doing everything we can.
Maxine Friedman, Newton News, Newton Center.